What is urinary bladder? The urinary bladder is a hollow, distensible muscular organ situated in the pelvic cavity, posterior to the pubic symphysis. In males, it is directly anterior to the rectum. In females, it is anterior to the vagina and inferior to the uterus. Folds of the peritoneum hold the urinary bladder in position. When slightly distended due to the accumulation of urine, the urinary bladder is spherical. When it is empty, it collapses. As urine volume increases, it becomes pear-shaped and rises into the abdominal cavity. Urinary bladder capacity averages 700 to 800 ml. It is smaller in females because the uterus occupies the space just superior to the urinary bladder.
There are several interesting facts about urinary bladder. The dimensions of the urinary bladder vary with its depth of distension, but a full urinary bladder can contain as much as a liter. The bladder is like a balloon and swells into a round shape when full and gets smaller when empty. If the urinary system is healthy, urine may stay in the bladder for up to about 5 hours before excretion, depending on the amount of liquid consumed. We also obtain some fluid from food. The average person passes approximately 1.5 liter to 2 liter of urine in 24 hours. Women's urethras are much shorter than men's due to the difference in genitalia. A normal bladder completely empties every time you pass urine, and a normal bladder does not leak.
In the floor of the urinary bladder is a small triangular area called the trigone. The two posterior corners of the trigone contain the two urethral openings. The opening into the urethra, the internal urethral orifice, lies in the anterior corner. Because its mucosa is firmly bound to the muscularis, the trigone has a smooth appearance. Three cords make up the wall of the urinary bladder. The deepest is the mucosa, a mucous membrane composed of transitional epithelium and an underlying lamina propria, similar to that of the ureters.
Rugae, the folds in the mucosa, are also present to permit expansion of the urinary bladder. Surrounding the mucosa is the intermediate muscularis, also called the detrusor muscle. Around the opening to the urethra, the circular fibers form an internal urethral sphincter. Inferior to it is the external urethral sphincter, which is composed of skeletal muscle and is a modification of the deep muscles of the perineum.